Yeah.
We will go ahead and get started because it's so quiet. Okay. Good evening, everybody. This is the regular meeting of the Boulder County Board of Health. The date is December 12th, 2022. Time is 5:31. This calls this meeting to order. Item 1, public comments. Jordan, I believe we don't have anybody that signed up for public comments.
Nope, we do not.
Okay. And item 2, approval of the November 14th, 2022 regular meeting minutes.
This is Brooke, and I move that we approve the November 2022 regular meeting minutes. Second.
Okay, motion and a second. All in favor?
Aye.
Okay. Okay, so with that, item 3 is approval of resolution 2022-02, adopting 2023 recommended budget. Welcome, Morgan.
We are happy. Okay, so we are seeking the board adoption of resolution 2022-02, which formally establishes Boulder County Public Health's 2023 recommended budget. As you may all recall, we met November 2nd to have our budget work session. Since then, we have not received any additional requests or modifications from the board on the budget. We did apply salary adjustments based on some updated county calculations. We did remove one funding source and we added in 7 funding sources since we spoke last. And we also applied the estimated 2023 insurance costs. So those were some impacts to the budget that we saw. Budget Resolution 2022-02 identifies the total balanced budget of $27,234,037. By adopting this resolution, it also authorizes Boulder County Public Health to receive sustainability tax, Genesis Generations funds, HHS ballot 1A funds, and county funding for specific FTEs. Those other funding sources that I identified are historical funding sources that we've received from the county. So each time the resolution is signed, it just allows us to receive those funds continually. We also want to acknowledge that BCPH will tentatively present a budget amendment per the standard in the spring to identify any funding shifts or needs. So I ask if you have any questions.
Now, so can you just remind us one more time? So then we vote on the final operating budget in March or April?
Yeah, so the amended one will typically, it's a March, April time. So I think we identified tentatively April 10th. That's the date when we would do that.
Okay. No comments, questions? Okay.
I move that we approve resolution 2022-02, approval of 2023 recommended budget and submission to county. And I'll second.
Okay, we have a motion and a second. All in favor?
Aye.
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 All right.
Landry's on.
Oh, hi, Landry.
Hey, sorry guys. I'm like running around tonight, but dealing with my car and stuff, but.
Well, great work, everyone. I know that was it was definitely a complicated, it seems like that's the kind of recurring theme. Something always happens every year to make the budget a challenging process. And so we really appreciate all of your efforts and hope that the next budget, everything's working together and you guys will have a lot easier time.
If that is an incentive to stick around, Catherine, then I don't know what else.
I would just like to note too, that budget of over $27 million is 50% higher than our budget typically is. in a given year pre-pandemic. 50% higher. So it's a lot. It's been a lot.
Okay, so item 4 on the agenda is approval of salary adjustment for interim executive director. This is something that we discussed in our executive session from November. Lexi has been serving in this interim role now this is her 6th month. And it will likely probably continue on for another couple months before we have gone through the hiring process and determined who the permanent executive director is going to be. As a result of that, we think that it's fair to, while somebody's wearing 2 hats for this long, to capture that in the salary. I am trying to find. Letter. Okay. So I'd worked with Julia Larson in Human Resources. And so I think so what we are approving is a 7.5% salary adjustment until we have resolved who the new permanent director is going to be. And I can say the amount, right? I have to say the amount, don't I?
Kate, I would defer to you.
That information, it is public record. If you want to frame it in terms of percentages, I think that's okay too, but the actual numbers are public record.
Okay. Well, it is a 7.5% adjustment. That will likely be in place for the next couple of months. So with that, I'll leave it there and see if any of the board members have a comment.
Thank you for continuing to be the interim along with the deputy.
Is this, I can't remember, is this increase retroactive?
It is, okay, good.
And so, okay, can we get a vote?
I move to approve the salary adjustment for interim executive director.
And I'll second.
Okay, motion and a second. All in favor?
Aye.
Okay. We are moving right through this agenda. All right, item number 5 is a review of 2022 Boulder County Public Health accomplishments.
Wonderful. Well, welcome tonight to our last Board of Health meeting of 2022. It's been a long year, but it's also been a year of a lot of change and a lot of accomplishments. And staff really wanted to just take a pause with the board and be able to share some of the things that might have flown by so quickly you didn't notice, or just are worthy of kind of an end of the year wrap up. It's going to be a high level review. Each division manager and director has a slide, and Keith Rawls will be presenting on some of the Health Equity Coordinating Committee and Health and Racial Equity work updates for us. We would ask that, well, I was going to, we had planned this the last time we did this presentation. It went over so badly a couple of years ago that we had this really tight process, but we do have a little bit more flexibility today than we did. So maybe we don't need to be quite so rigorous. Clarification questions are great. Maybe depending on how we're moving through, we can hold deeper dive questions till the end. And if we can't get to everything tonight, of course, write them down and we'll be sure to answer any of your questions in the next director's report. I would say also that part of our interest in doing this evening is to hear from the board. Where do you all have specific interest areas that you'd like to take a little more time with in the future agendas for Board of Health meetings? We try to develop the agendas to be interesting for you all and to hit on spaces where you have questions or will want to go deeper. But it's also really helpful for you to see what the full lay of the land is. So you can really give that perspective of what you'd like us to attend to. So on that note, I will jumpstart us a little bit. Next slide, please, Jordan. So just a few of kind of the agency level accomplishments for the year. I won't read them all, but just to highlight a few things that other people won't be talking about. I think one of the big interesting challenges of this year was to see that we were able to make as much progress in advancing staff pay equity as we were. We moved around 50 positions, which included review, analysis, and proposals with HR to establish who needed to be shifted by how much, sometimes involving reclassification. And this is something that, when I started at BCPH a couple of years ago, was talked about as an ongoing issue for the agency. And, given that we were able to address about a quarter of our staff who were having pain points in this space, it just felt like a real accomplishment. And we're really proud that we were able to do that for our staff. We had a lot of emergency responses this year. We hope that, 23 brings us a little bit of a refresher or a respite and a refresher on what our emergency response planning is, and be working on that. Planning to bring you some thoughts in January or February about how we kind of reground our emergency response work in Boulder County Public Health. We were able to fund some really significant initiatives, not just the emergencies of COVID and MPOX, but also the Universal Home Visitation Program, Family Connects, received a couple of $1 million from the county ARPA funds, and also a significant funding, over a couple $1 million to advance housing affordability, both of which have significant public health leadership in those spaces. So we really appreciate the county recognizing our capacity to lead in those spaces and giving us the confidence, their vote of confidence to move that work forward. The Family Connects work is something that's been in development for years for those of you who've been here. And so just really proud to have launched that work this year in a year that had its own challenges alongside that. We've been doing a lot of work on organizational culture, both within the management team, among the supervisors, and really trying to develop out plans and pathways for how we both keep that work going, how we create an agency staff at all levels that feel like they're connected to each other, that feel like they know what their expectations of each other are, and that we're able to have hard conversations about things that we need to be able to talk about, that keeps our work going, that we're not, skipping over difficult conversations, but we're also able to have them in a way that feels respectful and positive for people and keeps us moving forward, as we really, not only in the space of racial equity, but also in a broader just agency connectivity and morale space. We have done a lot of work to recenter participatory approaches to agency discussions and decision-making, and really worked to strengthen transparency across a variety of levels of the agency, so that even frontline staff are hearing what's happening in management team conversations, so that staff know where to go to find information on the director's report, or to participate by watching a recording of the Board of Health report, and to pull that information back. We've done a lot of work to synchronize our meeting agendas so that information is flowing through those agenda items and back up to management team too. We'll continue to work in that space. Finally, I'll just mention one more. We've really made a lot of progress, I would say, in the last year in strengthening our collaborative approaches with county departments, particularly community services and housing and human services, in the areas of community engagement, behavioral health planning, the opioid litigation, funding distribution, fentanyl response, coordination group, and beginning to gain momentum in climate action. So really proud of a lot of those shifts that we've been able to make this year. And with that, I will turn it over to Kelly.
Lexi. Take a couple minutes. Basically, as a reminder, the strategic initiatives teams work across the agency and with the different divisions, right? So I'm not going to hit on all these either, but I'm going to hit some of the critical ones. So I think one of the really important things we've done is filled critical staff vacancies because we struggled like all year long to get the right staff in place, and we're almost there. I have my bottle of Haitian rum waiting until we get the last person hired. And a lot of the year, the first half of the year, we were still in the COVID response, Marshall Fire. So all our team and SIB, all our different programs that we have within SIB, were supporting the COVID and Marshall Fire. And then we were able to shift some of that work, which has been really great. And we have a long ways to go still, but we're able to shift that. For the health planning and evaluation team, I think the main thing is around strategic planning, right? So the community health assessment, the public health improvement plan, the community health profile, and then the broader agency strategic planning. That's dominated this year and will take all of next as well. So that, but we are fully staffed in that space. And so we're pretty excited, right? The IT team has just done a great job. Dina and her team have of keeping the whole agency running, right, with the IT support that they need. We're looking at some on-site IT equipment and looking at, again, some of the things that Lexi mentioned, and we're shepherding new program IT platforms like Family Connect, Cicella, and things like that that really help programs. For the comms team, there was a lot of emergency response communications working hand in hand with Indira and her team on the, and Joe and his team on the Marshall Fire, the COVID response, the data dashboard. And we had some folks come and go in that team. But we're really trying to upgraded our capacity, our capabilities, especially in video and social media, which are going to be really helpful as we go into 2023. And then on the mental behavioral health, at the beginning of the year, we, because as you remember, mental health was our current strategic plan's priority, and it was derailed by COVID. No surprise there. But at the beginning of the year, we set aside around $50,000 for some youth small projects around mental health. And so those are going to wrap up at the beginning of 2023. And so that's going to help us as we look forward into reporting back to the community and then transitioning into part of the new plan. And development of the MBH framework, which Lexi helped us with a lot, and a lot of the community health people. Heather and their team did a great job in that space as well. And our new mental behavioral health coordinator started today. So that's sort of a brief synopsis of things that happened this year. And I'm passing it to Indira.
All right, thank you, Kelly. Similar to Kelly, the Communicable Disease and Emergency Management team has been in a year of transition. We are definitely finishing year 3 of pandemic response, and our focus for 2023 is to really focus on recovery and getting people back to their pre-pandemic jobs. So part of that was really diving into burnout. We experienced a lot of burnout after the Marshall Fire, the staff did. And so we did a lot of work to support those teams and ensure staff retention. We are also working on some data analysis regarding the COVID
data and taking a deeper look back and seeing how did we do. And a preliminary analysis is demonstrating some lower COVID hospitalization and deaths compared to some similar counties. So we're starting to think about how do we get that and information disseminated. And then lastly, just as overall, we've been running some monthly courageous conversations about race. And Keith was actually recognized last week at a countywide racial equity group in the work that he's been doing. And that was actually started by Sheila Davis. In terms of the epidemiology team and the resource navigation call center, you know, after 3 years, we have to take back on, we have to start resuming all case investigations for all reportable conditions. So what you may not be aware is that during COVID, because we were so focused on COVID, all of the reportable conditions were being handled by the state. And so that continuity of operations is ending. And the call center and the resource navigation team continues to provide services and supports. They're also doing some more work in the field with immunization clinics. Emergency management continues to support pandemic response, but they're really heading towards the recovery spaces. All of their equity work that they did during the pandemic is actually what probably made us super successful during our MPOX response, which we felt like those equity principles and practices of bringing subject matter experts in like Jack Gonzalez from Community Health, as well as our community partners from the very beginning, that inclusive approach really helped to make our response go smoothly. The harm reduction program is looking at securing that opioid litigation funding and is also looking at an implementation of a fentanyl response plan. There's some new grants that are on the horizon. And the immunization program continues to offer all things COVID, first doses, second doses, boosters. And this year they had to incorporate MPOX and flu into their clinics. The good news is that the children's clinics remain busy and they continue to meet people in the community where they're at. And they're offering a lot more offsite clinics. So a very successful year 3 for CDM, and we look forward to 2023 and a fresh start and moving into that recovery phase. And I'm going to pass it off to Heather.
Just a note on this, Indira, I recently learned through personal experience that BCPH and Walgreens are the only ones doing under 5 shots for COVID right now. Oh. So it is like, it's hard to get access outside of PH.
That's good to know, Morgan. Thank you.
All right. So for the community health division, our teams continues to provide subject matter expertise to the agency around youth engagement, community engagement, equity, really just kind of involved across the agency whenever we need discussions having to do with any of those topics. We're still in final calculations, but it's looking like in 2022, we served nearly 1,500 young people in our community, which is really exciting. And I'll touch just quickly a highlight from each program. The Genesis program did successfully implement Healthy Families America, so they're considered accredited as an evidence-based program. They've met all their markers. So that's really exciting. They are considered affiliated right now, and they'll become fully accredited at the 18-month mark. So that's really great. Generations, thanks to some of that youth mental health funding that Kelly discussed, they partnered with the Oasis program, and all of the youth together put together this really great video, which I'm thinking we should make sure y'all get to see. To talk about mental and behavioral health with LGBTQ and Latina youth. The Oasis program served over 750 youth. Just had an amazing year of rebuilding and building new community partnerships and connections across the board. Our Tobacco Education Prevention Partnership, or TEP, is really a leader in the nation right now on vape prevention and vape disposal in partnership with the Hazardous Material Facility. So they've presented at several national conferences. I talked to someone at APHA who had talked with our staff here about duplicating that program. So that's been really cool to see. And I thought their local ad campaign on TikTok was pretty cool. They had over 2 million impressions. It's called All Facts, No Cap. You know what no cap means? It means no lies. The youth designed it, so that was really cool to see. And then the Community Substance Abuse Prevention Program, staff in that program continue to provide leadership on mental and behavioral health, opioid settlement discussions, fentanyl discussions, and have many successful coalitions running around those topics. So that's kind of what we've been up to. Had a really great year and looking forward to 2023. And I'm gonna have to hand it off to Joe.
Good evening, Board of Health. Joe Malinowski. I serve as the Environmental Health Division Manager, and I have the distinct pleasure of just highlighting just some of the work that we wanted to recognize in the Environmental Health Division that we did over the last year. I think if you look through this list, you'll see that one of the challenges, it really was a challenging year. I think a lot of the staff were just coming off a COVID response and the Marshall Fire in January. We immediately responded to that, but I think sometimes staff do the best work when they're challenged, and I think that's just a real testament to the leadership of my coordinators and the staff that do this work every day, and just really are wanting to support the community during these kind of disasters. But when you just look at some of the work in the air quality program and Healthy Home, just setting up that air monitoring network in Marshall Fire, and some of the research we did on indoor air quality and outdoor air quality with NOAA and CU and CDPHE really stood out. And then some of the pilot projects we did more recently in some senior homes, looking at low-cost air particulate filters that could be used. In climate action, we really formalized the Climate Action Advisory Team and developed an emergency heat plan. The food safety just did an excellent job helping all those restaurants recover from the fire, post-Marshall Fire. And they've really done a great job meeting some really high standards that the FDA set for voluntary food programs, and it met 8 of those 9 standards. The Heal and Built Environment Program continues to advance the healthy beverage policy and really building toward a state model. And they really went all out and scaled up a healthy food access to meet community needs over the last year. And they continue to try to advance mobile home park residents' rights. The water quality program, again, some of the research we did for private drinking waters with Purdue University was really outstanding, innovative. Obviously, continuing the work that we did in our OWTS permitting program, and then just some really great work in the soil testing protocol and just establishing debris removal requirements post-Marshall Fire, with just some additional work that was really great. I really skipped over the administrative support because I wanted to circle back, because I wanted to save just a few minutes, or at least 1 minute, to really highlight their work, and just wanted to really thank them for the work that they do every day to support each of our programs. You can see that we have thousands of community interactions we do, that they really lead that every day, servicing our programs, whether it's just working with individual customers or doing the licensing of all our retail food restaurants or OWTS permitting, working with all the industry folks. Again, just do a great job supporting our teams, and we could not do our work without them. Happy to answer any questions about what we did over the year, but really, I think it was overall a really successful year. Thank you.
Great, thanks, Joe. And with that, I would like to just highlight the Family Health Division. My name's Daphne McCabe, and I'm the Family Health Division Manager. And if there's a theme that kind of runs through all these bullet points, it's that we're focusing on family voice and family choice. And we serve over 3,000 families a year through all of our programs. With the Women, Infants, Children, they've done an incredible job of maintaining remote services this year, and have really promoted well child visit follow-throughs, which have been incredible. And they've been working on culturally diverse food packages and online shopping, which we're super proud about. Nurse Family Partnership has secured funding for early childhood mental health consultation, and they also have increased their services to monolingual Spanish-speaking families. Again, a huge accomplishment. Child Health Promotion has focused on family, friends, and neighbor outreach, which is a brand new field, and it's about 50% of all childcare choices in the community are family, friends, and neighbors. So it's very exciting to now be reaching this community. And they have incredible programs like Farm to ECE, et cetera. But they also worked with environmental health and partnered on the recovery from the Marshall Fire, which we're really excited about, the ways in which safety of children and childcare centers is becoming more and more visible. And same thing with the EPI teams in terms of supporting outbreaks. For children with special needs, we were able to do several just best practices and promotions in the community, including translating the developmental screening and early intervention referral training into Spanish and presenting that at a Spanish-speaking conference. And then finally, in Family Connects, we've been piloting with Boulder Community Health. We've had tremendously positive uptake in our pilot. And we're in negotiations with other hospitals. And we hosted a monolingual Spanish-speaking postpartum focus group, which again is core to just elevating family voice and giving power and sharing power to with our parents in the community. So, and that's it for me. I will pass it off. Thank you.
Great, Catherine Palmer, Director of Admin and Finance. So the theme for Admin and Finance really has been recrafting, regenerating, and also just lifting some of our systems back up that had not been utilized or needed a little bit of a refurbish. So the biggest thing is we completed reconfiguration of the admin and finance teams in terms of the phase one of that, which is very exciting. As of last Monday, we hired the last new leadership person on, which is our new contracts and purchasing manager. So I'm incredibly excited about that. We have reworked, as you all are very aware of, reworked the entire department budget. And our final check with that will be uploading it into the new county's budget system. So we've also been completing trainings on that and learning about all of those things, which will be incredibly helpful to our managers going into the next year. We have coordinated ARPA funding monitoring. So that was something that had kind of fallen to the side when I first started, and we were able to snatch that up and get that going again so that we are meeting our requirements as subrecipient. We also refreshed our department's exit interview approach, starting to do some data collection on that, just so we can into 2023 start to make some goals around where we want to go in relation to that. We also updated our master personnel log. That was a big thing when I first started. We did not have a clear tracking of all of our staff and all the lovely things, the data points that go with them. So we created one master personnel log and we applied a pretty significant cleanup to that. So that allows us to better track and understand where our personnel are. We have kicked off the admin finance refresh project, which is really focused on process review and efficiencies. So we had some meetings last week, actually just started last week, where we're process mapping, and it was incredibly fun. I don't know, some people may have not thought it. I thought it was super fun. And so I'm just excited to see where we're going to go with that. With the help of Jordan, we have provided and made many updates to the board meetings, information and coordination. So excited for that work. We have also initiated site safety and risk assessments for our facilities since coming back to the department. And then I want to just highlight and focus in on one specific team that doesn't always get recognition, and that's our Vital Records office management team. So starting back in April, when we were going to open the office back up, they reopened the front desk to assist walk-ins for Vital Records. They're one of the only teams that is fully in the office every single day. Part of this, when we did this work, we wanted to ensure equity because we knew that other staff were going to still be working from home. So one of the things that we did first time ever was start scheduling appointments. So that allowed for us to be able to create backups. We have certain staff that work from home and certain staff that come in certain days so that everybody gets to rotate and consistently keep that equity within that space. And we've gotten a lot of positive feedback from the community that they appreciate the scheduling and knowing where to go when they need to find those things. And then the other thing that we've seen specifically to this team is a 34% increase in Vital Records revenue this year, despite an increase in the state fees that we have to submit back to them.
What's that from? I mean, because I have a guess, but I don't know, but
Well, so it's twofold. I was talking to the manager during Bullard about this and he said, you know, you don't always want to talk about that being a goal to see an increase because that typically comes from births, but also from deaths. But he said one of the things that they've really focused on is actual partnerships with more funeral homes, seeking certifications. And so they are asking for more of the records specifically from us. And then just this ability to show individuals how they can access their vital records, whether it's electronically coming in, all of those different approaches, because of the fact that we do it, we have a bilingual approach, all of those things. We've seen more comfort from community members coming in to seek those services. So that's what he attested to and explains why we've seen that increase. So I will hand it off now to Keith.
We've asked, Marshall Fire had impacted that with the need to replace vital records, but apparently that was not something that related. Interesting.
Hello, everyone. I'm Keith Rawls. I'm the Immunization Program Coordinator. Thank you for having me in this space. Health and racial equity. The continuation on centering around or on race, racial equity was essential in recognizing and acknowledging that racial disparities exist. To combat these disparities, advocates say healthcare professionals must explicitly acknowledge that race and racism factor into healthcare. These efforts to identify implicit bias and structural racism in their organizations and developing customized approaches to engaging and supporting internal and external customers. The new agency approach was able to, quantify or qualify 5 goals that you see before you, but my favorite one is community engagement. Reason being, I like to say community leads and design feeds. And the design portion are the 4 legs of a table that hold up the community engagement piece. That's how I look at it. So those are the important attributes into making sure that we are attentive in understanding where the community is on their need and designing something that will fit their needs and meet them where they are. Some things else was born out of this work from the new agency approach was the redesign of the HRE manager position to align with the new vision and work. Also, intent of work in the charter, the HEC charter was amazing. Just going through that document and making updates as we need them to further our work within the agency. We also worked intensively to recruit new members to HEC. There's a vested interest from our agency partners, employees, I should say, to engage in this space. They love hearing about it. So we look forward to building that that orientation process and inviting new members into this space. And also developing work groups as well. I'm sorry, someone have a question? Okay, developing work groups. Those 4 or 5 before mentioned goals, work groups will be born out of that, out of those bullets, and I'm looking forward to engaging in this space to hear from our employees about how they would like to assist us in moving these strategic plans along. And last but not least, we successfully recruited a new HRE manager, Kevlin Mao. Kevlin uses they, them pronouns, and we can't wait to have Kevlin on board. Any questions? And do I need to pass it off to anyone else?
Right, I added your picture to the PowerPoint, so if there's no questions for Keith, I can move on to that.
Thanks, Keith.
Thank you, Keith.
Thanks, Kate.
You're
Thanks,
welcome.
everybody.
Yeah, thank you.
So, yeah, I just wanted to year in review. So Joe quickly talked about the Marshall Fire Response Team. And this was at the Colorado Environmental Health Association Annual Education Conference in September in Crested Butte. You can see a whole bunch of BCPH staff there on the Marshall Fire Response. They won award. And so I nominated for them for that. So it was a great moment. You might be wondering, geez, the outfits and the attire don't seem very evening wear. Well, it was a Back to the Future kind of 1980s theme. So you'll see a lot of familiar faces in that picture. And so, yeah, that was a pretty special moment. So a really tough job for the better part of the year. And, just really proud of the environmental health team. I get to see them maybe more often than I get to see other folks in BCPH. So just an amazing year. I did want to just clarify that currently, with the kind of time squeeze that we have with the regular board meeting, and we've been doing a lot of executive sessions, not only to hire the new director, but we had some executive sessions earlier in the year. And so this is probably just more of a temporary thing. I think that when you look back before COVID, our regular board meetings generally went till about 7. And that's fine, right? It's just that when we're doing executive sessions right now in the hiring process, that's why we've just asked for maybe a little bit tighter so we don't run too late, because we like to talk a lot too. And so we'll resume that, probably within a few months after the executive director's hired. So I just didn't want it to make it seem like we were not willing to absorb all the great information that we get so much with the mobile home resolutions over the years. I've really enjoyed learning about mental and behavioral health. That's not an area I come from. So it's been really worthwhile to kind of, just really be exposed to the full gamut of public health, which, until years ago, I was not. And so I really do appreciate that. And it does benefit me in my life and in my work. And then finally, I just wanted to say, well, anyway, I just wanted to say thank you to all of the BCPH staff. It's been a great run. I am on year 11 now. This will be my last 6 months. Then I term out. I actually got to go longer than 10 years because I filled the previous appointment. But it will be nice to, with my board members, hire the new executive director, knowing that, we did one last thing, or I did one last thing with this board of significance. So again, thank you, everybody. Really proud of you.
Here.
Yeah, and I'll just add, as the newest board member, I have been completely blown away by this whole organization, the staff. I mean, it's just incredible what you guys do. I was literally telling my vet about the vector conversation that we had the other night, and I was just like, do you know how many people are handling this for the entire county? So, I'm just incredibly proud to have joined this board. And to be working with all of you side by side, especially as we're emerging out of this crazy period that we're just in and into a new era that we don't know what that's going to look like. So just want to say thank you for me personally, and thanks for welcoming me this year. It's been a journey for sure.
Yeah, thank you, everybody. My primary interests are definitely in all things CDM, and we've heard from them a lot since I have been here. But what I would really like to learn more about is mental health, and particularly who is the county partnering with? How is the county interacting with mental health partners, with cities, the cities in the county, with the state? This has really been identified, as you all know, in the state and nationally as a critical point where we are failing, honestly, for the most part. So around there. Also, what's being done about the lack of providers? Does the county play any role in that or anything? And just how the mental health approach is developing, especially as we are going into this strategic planning. Also, we haven't heard a ton of in-depth stuff from a lot of like the women's health and family health programs. It'd be great to get some more in-depth presentations on that. And I think the last thing is the systems updates and admin updates, since we heard so much about that being a pain point from almost every director and every person we've spoken to here. And I know you're doing a wonderful job of fixing it, and we would just love to hear more about that. You inherited that issue. Yeah, so keeping up to date on the efficiency things.
All right. Well, thanks again, everybody, and please give our appreciation to all of your staff.
Yes.
This is a team that it's really easy to be proud to work alongside them and recognize their work, because there is something every day that's just fantastic.
It's appreciated.
Thank you.
Yes.
All right.
I tell everyone I know.
All right. So next on the agenda, we have a request for a vote to approve future executive sessions to discuss personnel matters related to the executive director position under Colorado Revised Statutes 24-6-402, sub 4, sub F. And I guess that is really just we've been in the midst and will continue to be for the short term of meeting an executive session after the conclusion of the regular board meeting. And so we will this is just inform that we will continue doing that until we have an executive director that's hired. For anybody who's wondering, all that feedback that we got and the information that was shared with Kelly and Cindy Smith about the focus groups and what you would like to see, we haven't forgotten about any of that. We're just kind of in this period where we're now starting to meet with the consultant who will be running this hiring process. And now I think a lot of these things will start to kind of work their way into what are we looking for? And then once we do have folks on board, how are we going to establish their goals, solicit feedback from staff, on a regular basis? That's not something we've traditionally done, at least in the years I can remember doing this. So hopefully this process and the evaluation process will be a lot more transparent in the future. Okay.
Did we need to vote on that?
So I believe this is.
We do need a vote. Yes.
I move to approve the future executive sessions to follow the regularly scheduled meetings through just February 2023. Acceptable motion.
Okay, and I will second that motion.
Okay, motion and a second. All in favor?
Aye.
Okay. So item 9, now we will go into executive session pursuant to CRS that I just repeated, to discuss the, extension process for the interim executive director role, the January board retreat, the interim executive director performance evaluation. So management and your team, you will be seeing a survey, probably not too dissimilar from what you saw in last March. And just so we can kind of use that and incorporate that into the board performance review. Okay. All right. Well, thanks again, everybody. We will look forward to seeing you next month. I hope you have the best of holidays. Stay safe and get those booster shots.
And enjoy some well.
Family time's coming.
Yeah.
Thank you.
Thanks, everyone.
Everybody.